in general, all community medicine in different, and there I discussed the health definition. I told you that you have to remember the definition of health throughout your life. It is one, so many definitions are there. It is a one sentence definition given by WHO, World Health Organization. And always say, I am repeating again, don't say who, always used to say WHO. Okay, in all, not only in exams, in your future life, suppose you are giving some talk in seminars or presentations, etc., always use the term WHO, that is World Health Organization. Throughout the world, all the member countries of the world are the members of the WHO, World Health Organization, and their principles, their strategies, their scientific discoveries, etc., are followed by all countries of the world. Okay, and from every countries or other things, there are representatives. The headquarter of WHO is situated in Switzerland, Geneva. Okay, and regional offices are there. In India also, there is Eastern regional offices and all those things are there. WHO is a very large organization situated in different countries. So many Indians are employed there, our students are there, so many students are there in WHO. Okay, so we have to remember the definitions of WHO, and today we will discuss the other aspects of health. I am starting with, again I am repeating this one, don't forget it, I am telling you, never forget it. Every word of it, health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. Here, social well-being, you can say also social and spiritual well-being. Then the examiner will be happy, he knows the letter of it. I have already told you, there is nowadays, but if you say this one, that will be correct. But if you can add a word more, social and spiritual well-being, that will be better. Operational definition, I have already told you that how to make healthy, how to make community healthy, that is all methods are given here, so it is a large definition. And already we discussed the physical domain, mental domain, social domain, spiritual domain of health. That is physical well-being, mental well-being, social well-being, spiritual well-being. All these are meanings are there. These meanings are discussed here. Okay. Now today I will come into epidemiological triad. I have already told you. Initially, we used to say, what is triad? Triad means ki? Triad, T-R-I-A-D. It's a simple term. Triad means ki? Triangle, triad, triangle. Initially, ancient times, not maybe ancient times, because medical science is not that old. Development of medical science mainly in the 19th century or coming to the 20th century much more. The so-called modern medicine, it is 19th century or like that. And development is much more in 20th century. When first antibiotic was developed, what is the name of the first antibiotic? All these are school questions. Huh? Penicillin, very good. Penicillin is discussed in around 30s or 40s during First World War or like that. After that, medical science developed fast, slowly and slowly, so many things and all those things are there. So previously in ancient times, people used to think, human beings used to think that disease or ill health is a curse of God. It was the curse. So when slowly and slowly modern theory comes, then first comes that first scientific theory of causation of the disease, it was a germ theory. Because in the early part of 18th century, 19th century, germs are slowly discovered. Okay, different types of germs like bacteria, virus, mainly bacteria to start with, bacteria, virus, parasites, etc., etc. So people used to think the causation of the disease is mainly the germs. Germs means bacteria, virus, parasites, etc., etc. Biological organisms. Plenty of germs throughout. Here, crores of germs are you are inhaling, you are ingesting. So many things are there. You are touching. It is in the skin. Everywhere germs are there. So they think that it is the causation of the germ theory. Then in the last suppose 50 years or so or 60 years or so, it first came that modern theory of the causation of the disease is the epidemiological triad theory. Epidemiological triad. So if only germs are there, you cannot explain the causation of disease. Suppose two of you are of the almost same age, almost same I should say socioeconomic characteristics, from the same type of family or like that. Both of you are going through rains. So, both of you are not using the umbrella. So the same type of rain exposure, both of you same, but some may suffer from cold, she may not suffer. How? So how can you explain it? If I get something from the rainwater or like that, suppose germ. So I am suffering from disease, but she is not suffering. This may happen. So it firstly think that it is the interaction between agent, host, and environment. Agent, host, agent may be germs or like that. So agent, epidemiological triad means human health and disease are the result of interplay mainly between three types of factors: agent factors, host factors, and environmental factors. So then causes the disease. All types of diseases you can explain by this triad, plus minus. Plus minus you can explain it, agent or thing. Suppose agent may be agent. What may be the agent? It may be, I told you, bacteria, virus, etc. So that is biological agents. These are biological organisms, biological agents. There may be physical agents. Agents may be heat, tremendous cold, noise. These may be the physical agents. There may be chemical agents. Suppose you are eating or you are inhaling pesticides, different types of chemicals from air and etc. All those things. Say agents may be chemical agents. Agents may be some mechanical action. You are writing or like that. Always there is friction going on all this things. So continuous friction. Or you are walking through the roads. Someone hit it. So trauma may be the agent. Hit by a vehicle may be the agent. The agent may be multifarious. Agent may be non-communicable also. Your cholesterol, different types of lipids, these may be the agents. There may be hormones, may be the different types of agents. All those things are agents. Different types of food factor, nutritive factors may be agents. Excess of it may be agents. Deficiency of it may be agents. If deficiency of nutrition is there, what happens? Malnutrition. You see, in the poor socioeconomic groups, rural areas, they are malnutrited, children are malnutrited. And in our society, we take excess of food and all those things. Our obesity develops. Okay, so both excess and both deficiency may be the agents. For this, it is said that everything optimum is very good for health. So you take optimum lifestyle, optimum food, everything. You can take everything, no doubt. But it will be agents. Someone in every evening takes, suppose, alcohol or all those things. If you take optimum level, may not be harmful. But if you take excess, then may be harmful. Okay. So everything optimum is very good. So the agent may be biological agents, physical agents, chemical agents, mechanical agents, different types. Socio-political agents. Okay, agents may be, if some community is poverty, literacy is less, lifestyle becomes much less, you are not exercising and all those things, you are not walking, always use, coming from the house, you use vehicle, going to the hospitals all the day, you use vehicles, go to the market, you use vehicles, so no exercise is there, and at home also you are not any working, your servants are there, they are cooking, they are washing your clothes, etc. Sometimes they help you in bathing also, as you see in the Western films and all those things, in the bathtub and all those things. So they are not doing everything. So that may be the agents also. The lifestyles also may be the agents. Okay. So that means agents may be physical agents, chemical agents, or biological agents. Okay. Now it is clear agent. So agent does not always means, so you must, to have a disease, you must have agent. Very, very important. That may be physical agents, biological, different types of agents, chemical agents, mechanical agents, or socio-factual, all these. That means not only agents may be single, but agents may be multiple, usually multiple, all those things. Now, host factors means your body factors. Age may be host factors. The same type of agent entering to your body and a child, who will suffer? Child will suffer much more. Agent factors. The same type of agent entering in the body to young persons like us. I am not young person, you are young person. So maybe to the old person, old will suffer more. That means host factors may be agent. There may be sex difference because body structures, etc. All these things. So sex difference, agent may be there. Your body immunological system may be different. Your hormonal level may be different. Women are having estrogen, progesterone, etc. But male are having testosterone. We are also having some types of estrogen. All these things we learn. But our much more hormone may be testosterone, all those things. Your enzyme and all those things may be different. You are now going on biochemistry class. Your biochemical factors may be there, and all these things. So host as body bolna, your body resistance ko bhalo. That means your genetic factors may be different. Genes are we always separate from one to another throughout the world. And I used to say it is a peculiar government. Now, no science can develop throughout this country. How many world population may be there? If anybody asks you, world population koto? Indian population koto? Huh? Million. 10 lakh 1 million. West Bengal population হচ্ছে 10 crores. Indian population is almost 140 crores. That is 1 billion. 1 billion, 1.4 billion. And world population may be more than 8 billion. 800 or 900 crores. So you see, almost 800 or 900 crores, your features are different. We can understand it. Exceptions are maybe they are twins and etc. So it is a peculiar that genetic factors, how much it differs. So host may be the genetic factors. So agent interacting with the different host factors, your genetic makeup, your age, your sex, your hormonal balance, your biochemical balance, whether agent maybe there, you are not exercising, maybe your cholesterol becomes much more. So agent interacting with the lifestyle factors, I am not doing exercise, etc. So accumulation of cholesterol is there, it may turn into, and other things, other triglycerides. So it may lead to the cardiovascular disease, etc. Okay, now coming to the environment. So agent, host. So host may be intrinsic factors, demographic factors, psychosocial factors. Intrinsic means body structure, biological factors. Demographic, I have already told you, age, sex, etc., aging, etc. These may be the demographic factors. Demography, there is a subject. Demos means population. After this class, I will go to the second year class. There I will discuss demography. You have also demography. So demos in Latin word called population. Graphy, you know, geography, etc. All these are study. Study of population is demography. Population characteristics. We have to know, being a medical science, in medical student or doctors, we have to know a bit of demography. Demography is a large subject, but you have to know it to superficial demography. Your age, population, size of the population, behavior of the population, etc., all those things. Psychosocial factors, I have already told you, your mental makeup, your social, cultural factors, family characteristics, etc., psychosocial factors. Environment also may be physical environment. So one suffers from malaria, the agent may be Plasmodium. You have heard of it, you will learn more. Plasmodium vivax, Plasmodium falciparum. So people cause, how malaria is caused, a layman will say it is caused by mosquito. Mosquito does not cause malaria. Malaria caused by Plasmodium. Mosquito is the vector. Okay, this Plasmodium. So breeding of the mosquito, if we belong, so for breeding of the mosquito, environmental, ideal environment should be there. accumulation of water, a bit of humidity, all those things. In very summer conditions, very heat environment, there mosquito cannot develop. Again, in very cold environment, cold, or if you go to the hilly areas, you may not see mosquitoes. But this season, I mean, a bit of after the rainy season, accumulation of water is there, and this type of a bit humidity is the later part of the summer. Their development of mosquito breeding much more. If mosquito becomes much more, this plasmodium is the life history goes to the life history of plasmodium in two types: in human body and then in the mosquito body. Sexual and asexual cycle it is called. So then environment is important. So environment may be physical, biological, and social environment. Okay. So in agent may be in the environment. Your host factors also affected the environment. You are in metro areas. So environment, a very boy or girl or children or adult from a remote area, not access to the malls, etc., etc. So they may not be access to that much of food, other things, different types of lightings, etc. But we are exposed to metro cities, all these things like that. So it is very easier to get different types of agents. You are getting more types of fast food, you are exposed to vehicle pollution, etc., and all those things. We always used to say in the rural areas. I am from Calcutta, but for 3 days I stay here. So during 3 days I used to say I am inhaling a bit pure air and etc., etc. So in the morning hours and evening hours I walk and etc., etc. Because a bit of pollution is less. So it is, the environment is different. Urban environment, rural environment, everything is different. Environment is very important. We used to say your class, if it is a conducive environment, your relation between all these things are there, then environment is good. In this hospital, if everything, environment is very good, there may be interaction between teacher and students are very good, then study and teachings and training classes will be much better and all those things. So environment affects not only agent, also host also, right? So this is interaction and between environment. So as the disease is caused by the interaction of agent, host and environment, so it is called epidemiological triad. Epidemiological triad, very important. Questions usually are asked, short, there may be short notes or there may be long questions, you have to write and all those things. And if you, some question may come regarding suppose prevention and control of any particular disease. So you can write in this fashion also, agent factors, host factors and all those things, builders and preparation. That is, you may not get in the books, but from your knowledge, if you write in that way, then examiner will be happy, he knows. Suppose a question comes, how can you prevent malaria in the community? So if you write the agent of malaria is plasmodium, etc. Oh, listen. Then you write a bit about environmental factors, mosquito, etc. Then you write about host factors, etc. Mosquito bite is there. If I use full sleeves, if I use mosquito nets, all those things are I will not get the bite of mosquito, so I may not suffer. But nowadays I have seen that I live near Ruby area. You know Ruby? In Calcutta, Ruby Hospital area, bypass. So there may not be that much of mosquito. I stay in the 8th floor or like that. So, but this is my habit from my childhood that I cannot sleep without mosquito. So if a single mosquito, all those things create any nuisance, I cannot sleep. So it is the habit. But nowadays I see people are not using mosquitoes. They are using what? These mosquito repellents. But they don't understand it is so bad for health. Inhalation, it is toxic chemicals completely. You are throughout night, you are inhaling it. It affects your lungs. But we are using mosquito. আমাকে মস্কিটো মশাই টাঙাতে হবে, তার জন্য টাইম লাগবে, কষ্ট করব না তো, শুধু ওইটা রাত দিন ওটা জ্বালিয়ে রাখবো। কিন্তু ওটা জ্বালালে যে কি ক্ষতি হচ্ছে, we cannot understand all these things. So this is that is it not only host factors, it is also environmental factors, right? So it is epidemiological triad is the interaction of agent, host and environment which causes the disease. Now coming to the same things, actually in community medicine you will see so many repetitions are there. Not only community medicines, whole medical science repetitions are there. What I am discussing this class in other discipline or other subjects also, some same type of maybe overlapping is there, because it is a causation of the disease. It is due to the health. Health is the interplay of different factors. So different science also, something you will get. What I am talking, a medicine class also may talk like that. I am talking about lipids and all those things at the time. You may get those things in the biochemistry class also. Okay. So here also in the same subject there may be repetitions. So I have already discussed agent, host and environment. So determinants of health means, how health is determined. What are the factors which maintains your health. So that means biological determinants I have already discussed, physical, all those things, biological, physical, bacteria, virus, etc., biological, and your biological factors, intrinsic factors, etc. There may be environmental determinants. I have already discussed environment. Environment consists of your external environment, internal environment, internal. So environment does not always means only air. It is air, soil, water, everything environment, and the socio-political environment where you are working. In the family, there are your indoor air. Your kitchen is there. Some fumes are coming out. Whether you are allowing external cross ventilation, that also depends on if cross ventilation is there indoor, or sometimes you stay by the side of the road. So many vehicles, suppose in Calcutta, so many vehicles are running. So people make it close and etc., all those things. So we use, of course, AC and other things. But again, I am telling you, we are not thinking. These are called air conditioner. What do you mean by air condition? Air conditioner means these machines should condition my air. It will don't allow to enter not only bacteria, virus, parasites. It will not allow other pollutants also, chemical pollutants, etc. But these machines are not like that. They are only giving cold or according to the temperature. They are pumping air in your room, but they are not conditioning the air. Ideal air condition should condition your air. That means it not only give you cold or heat accordingly, temperature control, but also it will control your biological organisms, your pollutants, chemical pollutants, air and all those things. So, I mean, the ideal air conditioners are very, very costly and etc. They are conditioned, all these things. There are some filters up there. It controls some dust and all those things. Okay. So, that is environment. Environmental factors are there. It will determine your health. There may be behavioral, social, socio-cultural factors. Your individual behavior, the social behavior and socio-cultural, in different societies, different types of socio-cultural factors are there. Okay, it may be in the rural areas, it may be in the rural areas, it may be in a religion-wise or community-wise, some socio-cultural factors in tribal areas, some socio-cultural factors in very religion-wise, it may be Muslim community, it may be Hindu community, or maybe in the Christian community, etc., etc. So, different socio-cultural factors affect your health also. Socio-economic factors. We used to say that even we are a bit lucky. We are from better socio-economic group. From economically we are sound. Okay, so socio-economic, our literacy becomes a bit more. People are lower who are illiterate, who are not that much literate, who are suffering from poverty, who are not income that may not be that much. They are not access to that much of food, etc., balanced food, nutritious food, etc. So, socio-economic determinants are there. That also bearing on the health. So, community medicine always think all these aspects, but clinical medicine does not think all those things. Clinical medicine, someone suffering from disease, I will suffer from disease. So, whether I am writing medicines to my patients, very, very costly nowadays, so many medicines, antibiotics. I cannot, in clinical medicine, don't they think whether they have the power, economic power to purchase that medicine. Antibiotic you have to take thrice or 4 times daily. One antibiotic capsule may be 30 or 40 rupees. So one day antibiotic may be costly about 200 or 300 or 400 rupees. That may not be all these things. So for this reason, government and other things, they supply maybe free drug or free medicines through hospitals, government health centers, etc. and all those things. Okay, so that is, again, I am telling you, community medicine works through government systems mainly. Government system, I will come to that, who are the maintaining the healthcare delivery system. There may be municipalities, there may be, panchayat level, maybe something they are doing, all these things. So that is socio-economic environment is also, it affects the health. Health services. Health services means all types of services, mainly government health services and also private health services. Whether I have access to the health services. We often used to say, in urban areas, you are staying in Calcutta, access to health services there, so many hospitals are there, Calcutta Medical College, Arjikor, Nilratan, National, what not, Chittaranjan Cancer, so many PGs, etc., so many health officers, and even municipal health facilities are there, municipal health centers, etc., all those things. But in areas where may not be access to the health service, that means which are provided by government and non-government agencies. Okay, the health service where feasible and also it is accessible. So you are living here, maybe a health centers maybe 5 to 10 kilometers away. So how can you go there? Your transport facilities should be there. You must have all those things are there. So government is establishing health centers as far as possible. We will discuss all those things. It is often said a sub-center should be established for 5,000 population. For 5,000 population, one sub-center will be there. That sub-center should be manned by a ANM, all the nurse midwives and other health workers. Usually, medical officers are not in the sub-centers. And medical officer or doctors is available in the PHCs, primary health center. A primary health center is established for around 30,000 population. Why I am talking about 30? These are the norms. So where a health center may be maybe for 35,000 population, maybe for 40,000 population, but some primary health centers in hilly or rural areas in North Bengal, it may be for 20,000 population primary health centers. It varies, but in general, these are the norms established by Government of India and other health experts in community medicine. For 5,000, one sub-center, then for 30,000, one primary health centers, then coming to the block health center or subdivisional hospitals like Bolpur subdivisional hospitals, etc., and all those things. So health services are there. Gender also determinants of health. I have already told you, gender, there is sex differences there, who are suffering more, or genetic makeup difference, and females are XX genetic makeups, males are XY genetic makeup. So, and hormonal difference are there, genetic makeup difference. So, gender also determinants of health. Aging of the population. This is nowadays added, aging, I am telling you. Throughout the world, all governments are very much anxious. I don't know whether you are going through the newspapers and all those things. In most of the Western countries, the aged population becomes much more. So aged means they are dependent on whom? They are dependent on young population, who are the earning members. And who are the earning members? Suppose 20 to 60 years population, 60 years of age population. But more than citizens, suppose we are senior citizen now, all are above 60 and all those things. In some of the Western countries, because lifespan is increasing in a very good way, almost I should say in a very good pace, lifespan is increasing. India also lifespan increasing. Our average lifespan in India now more than 70 years. For average lifespan of females becomes 75 to 76 years. And average lives of males become 70 to 73 years. That means even in country like India also, the more than 60 years age population is more than 10% or so. It is said that in 2040 or 45, it will become 20% of the total population or 15% of the population in so much aging. So when aging of the population becomes in ages, there are different types of disease pattern also changing. They are dependent on the society. So that causes a burden to the society. And governments are thinking what to do. All governments are thinking. Some of the countries, all those things. There is a, old age homes, etc., etc. But health facilities may not be there. In our country, there are exploitation in the old homes, all these things. Most of you will learn more. Your mothers, fathers, grandmothers are still living. In some of the families, they are become 90 years or more. They are becoming bedridden maybe for 10 years, 20 years. So how much troublesome it is going on. It is a society, all those things. So this aging of the population affecting the health. Health means total health of the community, right? There are some terms you have to remember in community medicine. I used to say control of the disease, sometimes called eradication of the disease. Eradication, you understand? The last day I discussed what the diseases eradicated from this, our country, eradicated. Smallpox, polio, these are eradicated. Another disease, guinea worm disease, it was much more in Rajasthan areas. Now it is almost in the form of eradication. So many diseases are, we are working in such a way, we want to eradicate leprosy. Leprosy তোমরা প্রচুর পেয়েছো, আমি জানি না তোমরা দেখেছো কিনা বিখ্যাত ফিল্ম বেনহুর etc. and all those things. So leprosy and all those things in so many friends. Now leprosy is not that much. So many diseases are going to eradicate. So these are the terms you have to understand is very well. From prevention and control view, from community medicine point of view. Control means the disease agent continues to persist. It is there. It is there, but it is transmitted in so low level that the disease is not considered a public health problem. Disease agent is there. Disease is in the society, but it is not a public health problem. Suppose so many always used to, most of you are suffering from different types of influenza. It is it is not a public health problem. But one type of influenza, a few months back or few years back, it was very much public health problem. What? COVID. COVID is a type of influenza. Influenza, various types are there. Different types of viruses are there. Virus always mutate. So COVID, it was new. So it was called novel virus. So it causes public health problem. Now COVID also slowly becoming, it becomes controlled now. COVID, maybe sometimes you are suffering, you may be suffering also COVID, but it is not a public health problem. That is vast people not affecting, people may not be dying, etc. So many, pressure on the hospitals and all those things are not be there. So it may not be causing public health problem. That is, disease is controlled. We suppose in Calcutta areas, we want to control malaria during rainy season or after rainy season, during this time or also, etc. We want to control it so that it may not cause a public health problem. Vast people may not be affected. So it is controlled. Disease is there, but it must be in a controlled level. Understand? So it persists. You have to understand what is control. Someone may ask you. Eradication means total stoppage of transmission by complete extermination of the infectious agent. Smallpox, polio, it is eradicated, but the disease agent in the lab. Polio virus is kept in the lab for research purpose, etc. Smallpox germs may be kept in the labs. Okay, all those things. There is another term called elimination. Elimination is in between control and eradication. That is, sometimes you will understand all those things. There are different national health programs are there. Or almost most of the diseases, government national health programs. These are called National Family Planning. You have heard of it? National Family Planning Program. I don't know whether you have heard of it. You will be astonished to know India is the first country in the world to start National Family Planning Program. First country in the world. In 1952, India started National Family Planning Program to control the birth. It is national level means throughout the country, this program will run. The most expenditure will be borne by central government. It will be executed by I mean, central government money, central government planning, central government principles, but it will be executed through state governments. So for every national malaria control program, national non-communicable disease control program, national cancer control programs, and all those things are there. So for those, usually we maintain some level, that is reduction of the case transmission in a predetermined low level. We'll understand all those things. That is called incidence prevalence of the disease. We call it at all these things. Suppose in initially National Reproductive and Child Health Program, when it started, we call it our infant mortality rate should be below 30 per 1,000 live births. When we were students, I have already told you it was 150 or 200. Out of 100 live births, 1,000 live births, 150 used to die. Now it is less than 30. That is, we want to, so that is called elimination. That is predetermined. Just like control, but some level is given. Okay. There is another term called extinction. Extinction means specific infectious agent is no longer exist in the nature or in the laboratory. Polio and smallpox not in the nature, but maybe in the laboratory. So when we think that yes, for so many years no diseases are there in our country, in our state, so we are not doing any research, we will extinct that agent, disease agent, biological agents, etc. So we will extinction is there. So these are the some of the terms used. Now coming to the levels of prevention. This is very, very important. Any disease in our country or in the world can be, I mean, people become healthy, or you can manage that disease through these levels of prevention. Prevention does not mean only prevention of disease. Treatment is also part of the prevention. We will discuss all those things. Usually it is said that there are 3 types of levels of prevention. That is, on the basis of various phases of the natural history of the disease, 3 major levels of prevention is considered. Natural history of the disease, one class will be there in the natural history. A disease agent entering in your body. Immediately after entering your body, it does not cause the disease. It takes some long time. We called it a incubation period of some times. It may not cause that much of cellular damage. So we call it pre-pathogenic period. Pre means aage, pre-pathogenic period. I have already, the other day, last day I told you, your physiology class is there. Physiology means function of the cell, function of the organ, function of the body. When this physiology turns, cell turns damaged, it turns into pathology. So there is another subject develops pathology. You will have also class will be pathology, maybe more in the second year, etc. Your after the end of second year, pathology exams also will be there. So then disease symptoms and signs will start. Physiology turns into pathology. So like that, in disease agent entering, so it takes some time to my cholesterol level increasing. So one day when cellular damage will be there, or coronary plaques will be there, different types of thrombosis will be there. Say I may suffer from cardiovascular diseases. This is natural history of the disease. It's called disease agent up to the end of the death or complications. Whole natural history is there. Natural history of the disease, one class will be there discussed. So throughout the natural history of the disease, it has been studied. It has been found that there are 3 main levels of prevention. You can control or eradicate or eliminate the disease. One is primary prevention. Primary prevention means improving the overall health of the population by intervening before the health effects occur. Signs and symptoms develop and all those things are developed. That means how can you make primary prevention? Always think just after birth. A baby is born. You want to primary preventive measures so that the baby in future, when the baby grows up, becomes child, becomes adolescent, become adult, he or she will suffer from diseases less. 100% may not be, but at least as much as possible. So how can you do that? Common sense. Just after the birth, you introduce that breastfeeding should be continued as long as possible. The baby should not be exposed to infectious agents. এই জন্য এখন বলা হয় আগে আমরা বাচ্চাকে ধরেই কেবল চুমুটুমু খেতাম, যত কম বাচ্চার হ্যান্ডেল করবে তত বাচ্চা ভালো থাকবে, বিকজ ডিজিজ অলওয়েজ কামস ফ্রম দ্য হিউম্যান বডি। বাচ্চাকে বেশি বাচ্চা অনলি একজন দুজনের কাছে থাকবে, অল দিস থিংস ক্লিন, দ্য ক্লোথস মাস্ট বি ক্লিন, ওয়েন ব্রেস্ট ফিডিং ব্রেস্ট মাস্ট বি ক্লিন, etc. Hygienic should be proper, baby bath and wash should be much more, baby continued breastfeeding. So that is the primary prevention measures. So for this reason, that is preventive measures that are taken before the pathological process started, that is during pre-pathogenesis period, to prevent the disease. That can be done by health promotion, that is health promotive measures. So primary prevention can be done health promotion, steps and measures that are undertaken to improve the general level of health. Health promotion, promoting health. So I am thinking it is easier. You can promote your health. How? By doing exercise, by taking balanced diet, okay? By always maintaining good relations with your friends, mentally remaining healthy, etc. Not become stress and strain, okay? So, and by another thing, primary prevention can be by specific protection. You have to protect some diseases by specific agents. Measures to prevent the initiation of particular disease. All of you know. Example, so many diseases are specifically protected. Huh? Vaccine, very good. By giving immunizations, we are preventing so many diseases now. আমাদের টাইমে এত ভ্যাকসিন ছিল না, এখন প্রচুর ভ্যাকসিন, তোমরা প্রচুর ভ্যাকসিন পেয়েছো। ডিপথেরিয়া, টিটেনাস, রুবেলা, মিজলস, মামস, বিসিজি, that is TB, now pentavalent hepatitis B, so many diseases are prevented by specific protections. That is, you are giving specific preventive measures to prevent some specific diseases. So it is called specific protection, right? So primary prevention can be done mainly in two ways. One is by health promotion measures, suppose breastfeeding. You will not suffer from gastrointestinal disease if you take always safe drinking water. We are always taking bottle drinking, not all, always remember, not so many drinking water bottles are good, except I should not say here some good quality brands. Most of them are adulterated. It is better if you take water from, আমাদের এখানে আমার হাসি পায়, মানে আমাদের ফ্যাকাল্টিরাও অনেক সময় বড় বড় জার কেনে, এই 20 লিটার্স জার জলের, এই লোকাল বিক্রি হয়, সেগুলো নট অনলি দে আর সেফ ড্রিঙ্কিং ওয়াটার। ইউ টেক, তোমার আমাদের কিন্তু তোমাদের আছে কিনা জানি না, হোস্টেলে আমাদের কোয়ার্টারগুলোতে ইয়ে আছে, মেশিন আছে, অ্যাকোয়াগার্ড অ্যান্ড অল দোজ থিংস। ইউ ক্যান টেক ওয়াটার ফ্রম দ্যাট টেকিং ইউর, বাট হোয়াট ইউ আর ডুইং, ইউ আর বাইং বটলস। এটা আমাদের এখন হ্যাবিট হয়ে গেছে, পকেটে প্রচুর পয়সা, আমরা বটলস কিনি। বটল একটা দুটো ব্র্যান্ড ছাড়া, আমি নাম বলবো না, এখানে বলা উচিত নয়, বেশিরভাগ বটলস যেখানে সেখানে তৈরি হয়, বটলিং করা হয় ইন্ডিয়া। সো ইউ হ্যাভ টু থিঙ্ক অল দোজ থিংস। উই আর এডুকেটেড, আমরা এগুলো তো কমন সেন্স, এগুলো কোনো বইতে লেখা থাকবে না। আমরা সবসময় জল কিনছি, বাড়ি থেকে জল নিচ্ছি না, ট্রেনে ট্রাভেল করছি জল কিনছি, কত লোকাল নাম একটা হলেই হলো, সো মেনি নেমস অফ দেয়ার। সো if you take breastfeeding, etc., the specific protections, etc., on those things. So these are the primary prevention measures, and so primary prevention measures can be done by health promotion and specific protection. Then secondary prevention, that is measures applied when pathogenesis just started at the early stage, may not be asymptomatic stage. That is, you can do by early diagnosis and treatment. I have already told you, prevention, diagnosis and treatment is also your part. So that means if you do early diagnosis, do you know, suppose in cancer, so many things called prevent. What is the number one treatable cancer? তোমরা কিন্তু জানো অনেকে। Number one treatable cancer, breast cancer, very good. বসো, breast cancer. So if you call self examination of breast, you know Angelina Jolie, ওর যেহেতু মাদার ব্রেস্ট ক্যান্সারে ছিল হেরিটারি, ও আগেই ব্রেস্ট রিমুভ করে দিয়েছে। Nowadays plastic surgery is there, you can use artificial breast and so many things, all these things. So radical mastectomy it is called, all those things. So if you diagnose breast tumor etc. as early as possible, it is 100% treatable. তোমার পাশে অনেক মহিলা হয়তো ঘুরে বেড়াচ্ছে যাদের হয়তো ব্রেস্ট ক্যান্সারের জন্য ট্রিটমেন্ট করা হচ্ছে, ও এখন সে তুমি যতদিন বাঁচবে ও হয়তো ততদিন বাঁচবে। হোয়াট ইজ দ্য নাম্বার ওয়ান প্রিভেন্টেবল ক্যান্সার? তুমি যেমন বলে সেটা ফিমেল ক্যান্সার, সার্ভাইকাল ক্যান্সার, সার্ভিক্স, ইউ নো সার্ভিক্স, সার্ভিক্স জানো তো কোনটা? হ্যাঁ, কোনটা সার্ভিক্স? It is a female organ, vagina, cervix, then uterus. So in between uterus and vagina, that is called cervix. It is caused by human papilloma virus. So it is called that faithful sex is very much important. Your sexual partner should be one or not maybe more, one or two or maybe more. So if you have unfaithful sex on all those things, because human papilloma virus transmits through sex and other organisms. And if you remain hygienically good, if you are using all hygienically, your intestinal system, all those things, it is number one preventable cancer because it is caused by virus. It is called human papilloma virus. You will understand. So secondary prevention can be done, early diagnosis and treatment. Tertiary prevention means improving treatment and recovery. Measures taken at the stages of full-blown manifest and advanced type of the disease. Suppose you are disabling limitations. If someone suffering from disease, you are making treatment, management, etc. So your complications will be less. People does not become disabled, etc., etc. And rehabilitation, maybe some sufferings and all those things. Rehabilitation means suppose due to disease, suppose gangrene is there, so you have to cut the tear. So you have to rehabilitate that person accordingly so that he can earn his livelihood. He becomes socially acceptable, all those things. So rehabilitation. So levels of prevention can be mainly bound by three methods: primary prevention, secondary prevention, and tertiary prevention. Primary may be usually in two ways: by health promotive measures, health promotive, breastfeeding, balanced diet, exercise, etc., etc., taking safe drinking water, safe inhaling, less polluted air, etc., not coming in across the soil pollution, etc., etc., health promotive measures, okay, exercise, etc., etc., lifestyle becomes very, very good. And specific protection, you are giving specific agents or specific intervention, it is called, by giving all those things, immunizations or other things. Then secondary prevention means secondary level of prevention, as early as possible diagnosis and then prevention. It is said that if you diagnose it early, so many diseases cannot occur. You got all these things. ওই জন্য ক্যান্সারটা আমরা আন্ডারস্ট্যান্ড করতে সুবিধা, it is much easier. If you diagnose cancer as early as possible, your treatment becomes much easier and good, and that will be beneficial for your lifelong treatment, etc., etc. Then tertiary prevention means who are suffering from disease. So our hospitals called tertiary level healthcare because hospitals are last stage, and primary এরপরে anatomy class আছে না? So these are the mode of prevention. Actually, in the levels of prevention, you are doing that interventions, health promotion measures, specific protections, early diagnosis, etc. There is a term nowadays called primordial prevention. This is before primary prevention. This is called individual and mass education. Suppose it is you may not call it, you may not call it. So there you may call 4 levels of prevention: primordial prevention, primary prevention, secondary prevention, and tertiary prevention. But if you don't say primordial also, you will get almost full marks. But primordial a bit before, it is called some of the risk factors you can control by individual mass education. Suppose nowadays, especially in urban areas, if you control that, what is the danger of obesity, what is the danger of overeating, what is the danger of air pollution and all those things. So you educate the whole community you educate the whole particular community with those risk factors, they can avoid those risks. You can educate them about the nutritive factors, what are the balanced diet, etc. What should be taken, what should be taken. You can educate them, yes, don't take cold drinks or all those things, much more. Cold drinks টা আমরা বলি, it is a cold drinks দিয়ে bathroom wash করা যায়, জানো তো? Cold drinks দিয়ে bathroom wash করা লাগে। It is so much, so you must so much poisonous. অনেক এডুকেশনের পরে কোল্ড ড্রিঙ্কস এর কিন্তু কমেছে। অনেকে তো সকাল বিকাল পেপসি বা ইয়ে ছাড়া থাকতেই পারে না। ইট ইজ সো মাচ ডেঞ্জারাস। কোল্ড ড্রিঙ্কস খুব অত্যন্ত খারাপ জিনিস, ইট ইজ পয়জন অ্যাকচুয়ালি। সো অল দোজ থিংস, ইফ ইউ educate the people about the problem regarding this type of factors, your lifestyle, that means the primordial prevention. That is through individual mass education. Then health promotion, I have already told you, health promotion means health education, nutrition education, environmental modification, lifestyle behavioral change, specific protection, early diagnosis and treatment, disability treatment. That is, how will you label all those prevention? That is through these modes of intervention. Okay, so today, now from the next class, we will go to the specific topics. I have given the idea about the community medicine, levels of prevention, etc., etc., and all those things.